Right now on 12 on Health, using Olympic fever to motivate kids. Plus, a doctor and patient who swear HCG shots accelerate weight loss. And the skinny on some popular low-fat desserts. This is 12 on Health with Gillian Neff.
Hello everyone, welcome to this edition of 12 on Health. You're watching News 12 Connecticut, as local news gets. In a quest to lose weight, some people in southwestern Connecticut are opting for injections of the hormone HCG that promises to suppress hunger and trigger your body's use of fat for fuel. Now, health officials with the Endocrine Society say there's not enough data to show HCG shots work. But anecdotally, a local doctor and some of her patients say they are seeing results. We're joined by Lucia Lillian, who recently lost 60 pounds, and her doctor, Dr. Jennifer Jose of Darien-based Ultimate Solutions Medical Spa. And Dr. Jose is an internist and master of clinical nutrition. Thanks both of you for being here.
Thank you. Thank you.
It's so much fun in the TV world to have a visual example, and we've got one sitting right here. We have examples of the pictures taken of Lucia, also known as Lucy, beforehand. So we want to show folks the before pictures. This is a before and after. Of course, she goes changing her hair color too, throwing us off, a whole entire transformation. But clearly, you are, gosh, it looks like you're half your size there. And it's the kind of thing where you went to Dr. Jose and you said, yes, here's what I want to do, here's what I'm frustrated about. So you were willing, and you're willing to share your before and afters, even right down to the undies.
True. Yes.
But it's interesting. Why would you do this? I mean, a lot of people think, oh my gosh, I'm happy for her, but why is she willing to talk about it? Why are you willing to talk about it?
Because I have a lot of chronic health problems, and this diet pretty much gave me a new lease on life.
Had you tried others?
I have tried numerous diets, everything from, the common Weight Watchers to the packaged diets. The only thing I wasn't willing to try was bariatric surgery. I have pulmonary hypertension and a heart problem that's resultant from the pulmonary hypertension. I couldn't breathe. I didn't know what to do. My doctor said, there's nothing we can do for you, Lucia. You have pulmonary hypertension. And that wasn't good enough for me. Dr. Jenny, she's the one that said, I'm going to cry. She said, I can do something for you. I can make you live longer. I can make you feel better. She didn't say she could make my disease go away.
This is interesting. So Dr. Jose, when Lucy came to you, she said, I have an endocrinologist, among other doctors. My endocrinologist isn't big on HCG shots, but you are.
Yes, I am. Believe it or not, Gillian, it's been around for almost 40 years, and a guy by the name of A.T.W. Simmons, Dr. Simmons, was an endocrinologist back in the 70s, and he came and stumbled upon the HCG diet. And yes, it is FDA approved with fertility, and it actually was used for people that had testicular cancer and now with breast cancer.
Tell us what is actually in the vial that you put into the syringe and inject into the patient.
Well, first of all, HCG stands for human chorionic gonadotropin, and it was actually from the placenta of a female. But in 1927, it was actually discovered in the urine of a pregnant female. So what they did was they reformulated it into a clear form where in very, very small quantities, it actually hits the hypothalamus in your brain when it gets ingested into your system, or if you choose injectables. Once it's in your system, it actually activates two things in the hypothalamus, which is found in your brain. One is your metabolism. It actually speeds up your metabolism to a normal level as if you were when you were in your 20s, let's say.
Wow, Lucy, did you experience that?
Yes.
Was it right away?
Yes.
You're kidding.
Yes. And the weight loss was tremendous immediately.
That's interesting. You felt like it was almost like a stimulant in your system?
No, I wouldn't say that. I felt energetic and I felt kind of good about myself. And to see the weight falling off as fast as it did was such a empowering situation.
That is interesting. It boosts your metabolism. I don't usually ask people, our guests, to stand up, but I'm going to ask you to stand up for a moment because you clearly look good and feel good about yourself.
I feel great.
Is it different when you can go ahead and sit down? Is it different when you enter a room now?
Oh yes,
How
you're treated
so?
differently in this culture. If you're obese, you're nobody.
Yeah.
Oh God, that is just heartbreaking.
It's really
to
true,
hear.
unfortunately. And for me, I can breathe now.
That is interesting. So how did it help her beyond boosting her metabolism?
Well, besides the increase of the metabolism in the hypothalamus, it also hits what we call the satiety center in the hypothalamus, and that is a feeling of fullness. And the reason why you feel full is because once HCG is ingested into your system, it actually starts metabolizing, or let's say lipolysis is what we call breakdown of fat, of your own fats in your body.
And utilizing them for fuel.
Correct. So people say when they come upon this HCG diet, they kind of fear the fact that it's on a very low calorie diet, and and they question, like, how could you survive with a 500 calorie diet? And it's a very, very simple reasoning for that.
So the very restrictive low calorie diet is tolerable because the HCG is setting the stage? Is that what you would say?
Well, what happens is once HCG is in your system, it actually, what it does is it attacks your fat cells, just like, think about Pac-Man eating up all your fat cells. So when it does, in an average woman's day, it would probably consume about 1,500 to 2,000 calories in a female, and probably for average in a male would be 2,000 to 3,000 calories that's being used up and utilized by the HCG. And then you add a 500 calorie with that. That's a 2,500 calorie meal or a 3,000 calorie meal per day. That's why you're full.
That's very convincing. Now, in addition to giving her injections of HCG, did you also put her on a highly restrictive diet?
Yes. Actually, HCG only works on a very low calorie diet, which is a 500 calorie diet. And according to Dr. Simeon's protocol, if you go over 500, you will actually gain the weight that you've been trying to lose.
Oh, isn't that so? Oof, you really got to be strict.
It's very, very sensitive, and it's very restrictive. But
when you see it happening, you don't want to eat anymore.
Oh, that's
amazing.
You wake up in the morning, you go to the bathroom, you weigh yourself, and you do a shot. Guess what? Average for female is about a half a pound to a pound a day that you're losing, and for male, they lose almost 1 to 2 pounds a day.
Well, here's the question with so many things like this. It's doing something in your body, is what you're experiencing, but what if she stops? Will she then regain the weight?
Well, you know what? It's funny that you say that, because once you do even just one round of HCG, somehow it resets your metabolism, and it actually changes your whole relationship with food. Once you finish even just one program, because we have a 26-day program or a 43-day program. With a 26-day, you only do 23-day shots and you're done. And then you do a 6-week maintenance that is actually included with the program.
What are the side effects?
The side effects really, you get constipated occasionally, but out of probably about 9 out of 10 patients, they don't experience the constipation, but that's basically it.
Okay, I know it's one of these that you see the results, and of course it's feeling so good to be true. Cost.
The cost is for a 26-day would be about $1,600, because everything is included. Not only the 26-day, but included with that is a 6-week maintenance that you come into the office once a week to get weight and continuous nutritional counseling. Okay. And then after that, you do have 3 or 4 more visits, like 2 weeks after the 6 weeks, 4 weeks after that, and 4 weeks after that. And we don't let you go until you know exactly what you need to eat. And you know what you eat? Organic foods.
Okay, people are going to want to learn more, so we're going to send them to your website. Thank you both for being here. Summertime heads up for you next. Mosquitoes with West Nile flying rampant. What it feels like when people contract West Nile virus. A local survivor shares her story.